Now, over the next few evenings, we are leaning into an incredibly difficult topic, suicide. Experts say kids are struggling with more acute despair since the pandemic. Rates of suicide are up, and children are thinking about this extreme action at younger ages than ever before. We begin this important series with a roundtable discussion at the Institute of Living in Hartford.
Thank you, everyone, for gathering to do this. Really appreciate it.
A roundtable discussion with a young adult who attempted suicide, a parent whose son took his own life, and two clinicians. An open, honest dialogue started by Bo Treba, a 21-year-old who is transgender.
I grew up in an unsafe home environment, which led to increased suicidal ideation as a child. When I was 15, I had a suicide attempt.
And Treba isn't alone. According to the World Health Organization, suicide is the fourth leading cause of death among 15 to 29-year-olds.
There was no treatment given to me, no clinical treatment. I didn't go to the hospital.
Treba was homeschooled, but began making important connections at community college. Even so, the suicidal thoughts continued.
So when I was 18, I had another suicide attempt. And this was very tough.
Did you think there was no other way to stop your pain?
I wanted this relief from this pain, even if it was for 1 second.
Isolation is gasoline on the fire of depression.
Dr. Laura Saunders says transgender youth in general are struggling and embody risk factors.
They have additional vulnerabilities. They have vulnerabilities around social stigma. They have vulnerabilities around feeling different, and that can lead to isolation.
But for some, that can mean emotional isolation, sometimes difficult to see.
Brian was very social, very popular. Friends, family, strangers, he could connect with anybody.
Ann Daigle's son Brian took his own life when he was 19 years old, almost 11 years ago. He struggled with anxiety and depression, but no one expected this.
The summer he came back from school after his freshman year, I noticed he had lost a lot of weight, skin very pale, something a little off with him, just a little antsy. I saw him in October, and then we lost him in November.
Talk about the pain that a parent is left in. I mean, it's probably indescribable.
It is, exactly. It is indescribable.
Daigle now runs Brian's Healing Heart Center for Hope and Healing in Niantic, offering support groups for all kinds of losses, including for parents who lost children to suicide.
In Connecticut, we have $0 for suicide prevention.
Wow.
$0.
Daigle is working to change that through her work with the Connecticut Suicide Advisory Board, a collaboration of hospitals, state agencies, and survivors of loss, offering a multitude of resources.
And I often ask myself, if there were conversations, if there were programs out there, would my life be different? I don't know, but I would like to think so. So we're making a difference. We have a long way to go, but we're beginning to make headway.
We're seeing a lot of youth that are struggling, and a lot of the factors are kind of the ripple effects of the pandemic.
Patty Graham, a clinician at the Institute of Living, partners with families when there are safety concerns. She makes an extremely important point.
One of the biggest things we do with families is counseling on access to lethal means.
That means locking up guns and even over-the-counter medications.
The more we can help that individual who's in a very dark place get through it, and then find some help and hope on the other side.
Treba was hospitalized after the second attempt and received clinical treatment, which this young adult describes as a turning point. After much work, Treba took a test and is now a recovery support specialist with the Institute.
Does helping other people help you?
It does. Talk to children as though they are people, because they are. And they deserve to be treated with respect.
There are ways to end or minimize your pain without ending your life.
Saunders says the bottom line is talking about suicide, erasing the stigma, is the key to improving the current landscape.
It really is about reducing the shame and opening up those discussions.
Now, to see the entire half-hour-long roundtable discussion, you can just head on over to WTNH.com. Now, tomorrow we hear more about transgender youth and other young adults who have really struggled since the pandemic. And if you are in need of help, call the Suicide and Crisis Lifeline at 988. Darren and Ann, this is really just such a timely, important topic.
A tough one, yeah.
Sarah, there was a new study published today about how many kids, young adults, are seeking help in the hospital. Tell me about that.
So just today in the journal Pediatrics, it showed that between 2016 and 2021, there was a 59% increase of kids going to the ER with suicidal thoughts. And tomorrow we find out what Connecticut Children's is doing about this crisis.
All right, Sarah, thank you so much.
More tomorrow night. Sarah, thank you.